Good morning to you, to all those who help us here every morning, and to Gisela, and to all our audience tuning from different places in our country. This is the sixth consecutive day without deaths to report, and this is very gratifying. 389 patients remain admitted in our country's hospitals, 13 in surveillance, 181 are suspected, and 195 are confirmed active cases. In our primary healthcare service, our professionals and specialists follow 824 people. Yesterday, in the island's different molecular biology laboratories, 2,320 samples were processed. In the Pedro Curiel Tropical Medicine Institute Laboratory, 1,118. In Havana's Provincial Center, 346. In Santiago de Cuba's, 276. In Villa Clara's, 163. In the Brothers Amejira's Hospital Laboratory, 287, and in the Center for Genetic Engineering and Biotechnology, 103. As a result of the study of these 2,320 samples, 7 tested positive, representing 0.3% of the samples processed. Thus, in Cuba, for these 7 positive cases, 141,151 samples have been studied by our laboratories, and 2,280 people in our country have tested positive to COVID-19, which is 1.6% of all the analyzed samples. As it's been going on for a few days now, the 7 cases confirmed yesterday all are Cuban. Of them, 5 are confirmed case contacts, accumulating 1,988, that is 88.8% of the cases diagnosed in our country's epidemic have been positive case contacts. And we're talking about 1,988 people. Yesterday, in 2 of the cases, the source of infection had not yet been determined, and we continue to study to trace the source of infection. In the cumulative total in the Cuban pandemic, 90 of the diagnosed cases, their source of the infection has not been identified. I am referring to 4.02% of diagnosed cases. With source of infection abroad, the figure remains unchanged, 160 persons, which is 7.1% of all confirmed patients. Of the 11 cases diagnosed yesterday, 2 are male and 5 are female. In the pandemic in Cuba, 1,153 people are male. That is 50.5%, and 1,127 patients are female, which is 49.4%. 6 of the 7 cases diagnosed yesterday were asymptomatic, a fact that corroborates the complexity of this disease. 85.7% of all cases diagnosed yesterday were asymptomatic, and there are already 1,223 people in the Cuban pandemic, that is 53.6% of all confirmed cases, who have been asymptomatic at the moment of the diagnosis. If they had not been studied, either because they were contacts or because they belong to any of the risk groups that are under surveillance, they would have not been identified and would have been spreading the disease in the community. And that's the value of the studies that are conducted, which we expect to further extend in the community. Over the last 15 days, the percentage of asymptomatic cases has changed because in the last few days, practically 80%, that is 78.9% of the cases have not had symptoms, did not have symptoms at the moment of their diagnosis. I am talking about 127 out of 161 people who have tested positive over the last 15 days. By age groups, 3 cases in the 20 to 39 years of age, 3 cases in the 40 to 59 years of age, and 1 case in the group of 60 and over. Yesterday, no children were diagnosed with COVID-19, and they total 246 children who have tested positive during the pandemic, and they have had a favorable evolution, and 229 of them, that is 93.1%, have already been discharged as of today. All cases diagnosed belong to Havana, 100% of them, distributed in 5 municipalities, and the capital remains with the highest incidence of confirmed cases in the last 15 days. We're talking about 7.12 every 100,000 inhabitants. It has decreased with respect to the previous day, but still it is the country's highest rate. It is followed by Matanzas with a rate similar to yesterday's of 1.25 per 100,000 inhabitants, and the rest of the provinces: Artemisa, Ciego de Ávila, Granma, Pinar del Río, Mayabeque, Villa Clara, Cienfuegos, Santi Espíritus, Camagüey, Las Tunas, Holguín, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality have not reported any case in the last 15 days, no cases of the disease. Of the 2,280 patients diagnosed with the disease, 195 remain admitted. These are the active cases. Of them, 190, that is 97.4%, have a stable clinical condition. We always regret the death of 84 people as a result of this disease in our country, for a lethality of 3.68%, keeping the 18th place in this indicator in the region of the Americas. We have a person who works here was asking me how many countries comprise the region of the Americas. Well, we're talking about 35 countries which make up the region. The region currently has a fatality rate of 5.26%. Cuba's is 3.68% and ranks 18th among the countries of the region. And there are 10 countries in the region of the Americas with a fatality rate higher than the average of the region, which is of 5.26%. We always mention the 2 evacuees, and at the beginning of the pandemic, and yesterday there were 5 patients discharged. This makes the ratio of admission discharges to be unfavorable: 7 positive cases versus 5 discharges. In Cuba, 1,999 people have been diagnosed with the disease, have clinically recovered. That is, the person who have been discharged from the hospital, that's the clinically recovered person, and then there is the epidemiological discharge, which is the one that is granted 1 month. That is, after the patient stays 15 more days at home and all the PCR tests of the person have tested negative. So we are referring to 1,999 patients who have recovered. That is 87.7% of all diagnosed cases. Today, just like yesterday, we are reporting one critical case and four in serious condition. The female patient in critical condition is admitted at the Salvador Allende Hospital, and the patients in serious condition, two are in this same hospital, and the two others are at the Dr. Luis Diaz Soto Military Hospital, both here in Havana. Yesterday, one patient who was listed in serious condition showed some improvement and is now listed in guarded condition. And another patient was listed in serious condition, both cases at the Salvador Allende Hospital. In terms of the world, as of 12 o'clock last night, June 16th, the same 185 countries of the world remain reporting COVID cases. The number of confirmed cases with 118,617 new cases now stands at 8,847 cases. And with the 3,373 deaths yesterday, 436,632 people have already died in the world due to COVID-19, for a lethality of 5.46%. It's true that after such a long time have elapsed, it's been almost 5-6 months since the beginning of the pandemic and the first cases were reported. And one mentioned the data, the numbers, as something habitual. But just to think about the number of 3,373 deaths in just one day due to this disease, in just one day, it definitely speaks volume about the magnitude of this pandemic and the danger it entails. The region of the Americas confirmed yesterday 59,570 new cases and already totaled 3,907,668 confirmed cases. And that accounts for 48.84% of all the total cases reported in the world. And it already accumulates 205,585 deaths, with the addition of the 1,893 fatalities that were reported yesterday, for a lethality of 5.26% in our region. We could add that in the region, the United States tops the list of countries with the most cases, with 2,114,026 confirmed cases and 116,127 deaths, followed by Brazil with 888,271 cases and 43,959 deaths. And this is the situation in the world.